Hello. I say hello because I'm not sure whether it's the afternoon or the evening. So hello. My name is Xavier Hernandez. I am here representing a team from across the College of Health Sciences, the schools of medicine, nursing, the Plant School of Public and Population Health, and Pharmacy and Pharmaceutical Sciences. I guess I'll start by the foundational sort of philosophy that guides my work in this project, which is that it's difficult to confront extremism because everyone thinks they're the hero. And we talk about implicit bias a lot in this day and age as like, I have a negative implicit bias about another person. And we don't necessarily think about the positive implicit biases that we have about ourselves, that our behavior is rational, or you give yourself the benefit of the doubt, right? And having that humility and that self-reflection is very critical to addressing microaggressions, tensions, any sort of argument that may occur in any environment, right? And this is especially difficult in the medical field in terms of interactions between medical providers and patients, because both sides sort of have this stake in the matter, right? Where you have physicians, medical care providers who are providing an expert service. You go to a provider because you don't have the answer or you don't have access to a prescription or something like that. On the flip side, as a patient, you know your body better than everyone else. If you want to take a more customer service model, right? You pay for everything from the pills to the parking to the copay to your premium when you get it from your employer every month, right? So patients themselves also feel like, well, I have a stake in this as well, and you should be listening to me, right? So we have two sides that can sometimes reach, sort of irreconcilable differences, right, toward this goal of providing medical care, right, and figuring out, what is the best way to, as we say in the School of Medicine, discover, teach, and heal, which is our motto. So in thinking about this idea, right, of how to address microaggressions, one of the things that I often say about microaggressions is that one of the things that's micro about them is that you don't necessarily think about it in the moment, right? Sometimes it's an off-color remark, or maybe someone just turns a cold shoulder to you, and it happens so fast, all of a sudden tomorrow you're in the shower and you just think, man, that was quite awkward. And was that, especially discriminatory or terrible or whatever it might be, right? And oftentimes, especially in a fast-paced professional environment, you don't have the time to just take a second and think, like, what really was that? Or again, even if you want to support someone, you sometimes don't have the vocabulary to really think about that. So the project that we have, Read What Is Said, takes its name from a backronym, which is what everyone loves, a good backronym, right? Read and Said stand for 8 elements of a potential interaction that can help people sort of debrief and deconstruct an interaction, right? And to really think about what is it about this interaction that is potentially harmful or damaging for me. So this is not a checklist, this is not a rubric, right? But this is simply a way to understand the nuance of an interaction, right? What is the difference between if someone on Twitter says you have ugly shoes versus your brother or versus a boss or a coworker, right? Certain things like relationships, authority, who has accountability to influence someone's livelihood, right? These are the stakes in and the context when we say, oh, it's complicated, it's nuanced, case-by-case basis, right? These are the things that determine the cases. And again, this is not an exhaustive list, but just, again, further ways to think about what is that tingly feeling you get that makes it uncomfortable if someone says or does something to you or about you. Now, the project itself that we have in the School of Medicine and the College of Health Sciences is based on an interprofessional education model, which is standard throughout medicine and health sciences, where in this particular case, we brought together graduate, professional, and undergraduate students from our college to work in virtual meetings. So we had about 300 students who we organized together in 3 separate Zoom sessions. So there's about 100 students per Zoom session. And in these sessions, we controlled them for interprofessional demographics as much as we could. So we tried to put medical, public health, pharmacy, and nursing students in breakout rooms together. And they interacted in 2 scenarios. One was with a live actor, a standardized patient that is normal practice in the School of Medicine, where the standardized patient was being very difficult with them and not wanting to, follow their recommendations, throwing in slight jabs about, millennials can't park cars or whatever, right? Just like throwing out random things, right? Sometimes evoking extreme things, sometimes things are a little bit more subtle, right? And these, our interprofessional students were tasked with moving the interaction forward, right? Again, this is not a checklist and not a rubric. We do not presuppose that you will be the hero, right? It's about getting everyone through this in the moment and what you might do afterwards to debrief, move toward a policy in your program, move toward supporting one another interpersonally and things of that nature. The second aspect of the interaction was a video presentation where they viewed a tense interaction that was occurring in the break room, because we know from our interactions with our colleagues in the College of Health Sciences that that's where a lot of this supposed water cooler talk that we know about occurs, about issues of diversity, equity, and inclusion that are prevalent in our lives no matter what, as so many of our presenters have talked about today, that it is impossible to really think of anything like movies, sports, the billboards that are outside the hospital, right, as an apolitical or a space that is not meant for diversity, right? It is a new reality in our lives, and colleagues at every level will continue to have to deal with that, right? So again, in bringing together people from across the healthcare spectrum, we also hope to, of course, build these competencies about what the different arms of medical care can provide for our patients, and also help our students understand the different ways that they can complement one another's skills. And also, whether that's in the actual exam room, whether that is deferring someone to literature or resources, for additional care from a pharmacy or from an outpatient facility, et cetera, et cetera. But again, all of it really boils down to, again, understanding how and why these actions affect us, because it is undisputable that these actions do affect us. The what is undisputable. We know from research and anecdotal evidence that there are problems and tensions that are arising in our professional environments between colleagues, between patients and providers. But using a framework like this to be able to at least begin that conversation about what is it that is at the root of this problem. As I say to many of our medical providers in an analogy, a microaggression is the symptom, but we as providers are looking for the cause. So let's find the cause, right? This is nothing new to what we are doing. We are not reinventing the wheel, we are here to kick it into higher gear. This program occurred, when was that, a month ago? Unfortunately, due to a COVID surge, we were unable to do it in our standardized patient exam rooms that are in the School of Medicine, but that is something that we are hoping to do in the future. Admittedly, there was a bit of Zoom lag, especially with the standardized patients, people not sure when and how to step in. Not that that doesn't happen in real life, but we are definitely looking forward to continuing to implement this in an in-person environment and continuing to build our interprofessional identity as a college. You may have seen our new building that's under construction off Bison, where we hope that diversity will continue to be implemented into the curricula of all of our respective schools. So thank you all very much.